Welcome everyone. I see we have 35 participants here, and we'll like to wait a little more for others to join. But in meantime, I'll just like you to see the screen. You will have some myths and facts running for you. You might enjoy reading them and improve your knowledge or check your knowledge about dengue. This Project Fever, many of you are aware of. Some of your joinees are from DRL and some of you are from the RWAs we have tried to reach out to. This Project Fever is being initiated in partnership with Dr. Reddy's lab and IIPH Hyderabad. And we are also partnering with GHMC Hyderabad. We have realized that dengue is increasing in Hyderabad and it's a common problem in monsoon. There's a reason that a lot of brainstorming has gone through. And we have put all of this together, and we have realized that without the participation of RWAs, it will not be possible to have a successful program. While we wait for others, what I'll do is that I'll run you all, whoever has joined, as per the program, what the program is going to look like, and wherever you will also have opportunities to talk and raise certain questions. Just give me 2 minutes to just start that going. Right. So close to 4:05, I think we would start and people can join along. Right. So how the project is, the webinar is planned is, this is the second webinar in the proper series of our project. The first one we had for the engagement of volunteers. We oriented our volunteers, told them about the project, and we wanted them to reach out to their RWAs. This particular webinar is specifically planned to orient the RWAs, their representatives, their volunteers, and also to help them build a relationship with project volunteers and how they shall be working together. Because the project has already started in some form and our volunteers have started some work, I will request Mr. Shori to initiate once I'll call upon them, but just giving the brief of the program. He will talk about what has gone so far in the program and what our volunteer engagement has looked like. Then Dr. Murthy will come and tell you about what is the project No Fever and what kind of engagement is expected out of RWAs and volunteers. We realized that the program is more focused towards the prevention of fever. That's why we call it No Fever. Don't let fever happen. So as we talk about COVID prevention, we are talking about vector-borne fevers also. But we are also aware that in case there is any fever, then there's some support which would be required for the residents and through the welfare associations. So Dr. Bharat will give you a brief on what the project can provide you as a support. Then we'll open the house. We have received certain questions from you all participants. We'll take those questions which we already have, plus we will open it for everyone. So I request everyone all along, wherever they have questions, they can put their questions in the chat. We'll take those questions during this open house. Plus, if they want to verbally ask certain questions, they can raise hands. If you see your screen, you will have two options there, raise hands and ask question, where you can put the questions in the chat. Please feel free to put the questions there. They'll be answered all along. So Dr. Rajan will try to take as many questions as he can in the span of 10-15 minutes regarding the project. From there on, we will just take up a small story from the volunteers side, from the DRL. They have already been in the field, as I told. It will be a nice story to share and learn from. Lastly, I will talk about the activities which we would like to do in next 2 weeks. And this program is going to be from our side a 2-weekly engagement. And in between, we will request the RWAs and volunteers to do the activities as we go along and as we guide you. And at the end of it, we will again have a question and answer round. If you may have any questions specific to the activities which we are asking you to do. So this is how it will look. We'll want it to be more interactive. and engaging and helpful for you. So please feel free to ask the questions. So as per the plan, I invite Mr. Shari to from Dr. Reddy's lab to share his experience and talk about it.
Hi, good afternoon, everyone. Thank you for everyone who has joined us today. Thank you so much this afternoon for spending some time with us. I'd like to start by saying this is an extremely important initiative. We are aware that in the current situation with COVID-19 spreading unabated, none of us want us or our friends, co-workers, family members, our household help, anyone to be affected by dengue fever, and dengue fever is very critical in Hyderabad. Uh, and what we learned in the last 2 weeks in the first webinar was preventing dengue fever is very much in our hands, because while on the one hand, we are dependent upon our local civic authorities to come and spray insecticides, or our RWAs to do fogging of our surroundings to kill mosquitoes. There is actually a lot we can do to, in the first place, prevent mosquitoes from being born. So in the last 2 weeks, we have had over 84 members join the Telegram group. This is a huge success. First of all, I'd like to thank everyone for coming forward and joining this group. We did have 150 people who initially showed interest. So I request you all to please continue to talk to your friends, to your co-workers, and ask them to join this group, because the group is open. It's for all of us to volunteer, and it's a few simple things we want to do around our households. There has been a fair amount of activity in the Telegram group. About 10-15 members have regularly been posting. What you can see on the screen are photographs starting from the top left of mosquito larvae in a small flower pot, to, as we go along, people showing how they have worked around their house and with their RWAs to actually clear out water which is stagnant. We have committed that every Sunday morning we will take some amount of time to take a walk around our house as well as our communities, and many of our members have started to do this. We conducted a few snap polls, very quick polls, asking how much, what level of mosquito awareness and preparedness are you at? On a scale of 1 to 5, many people have said they're at maybe a 2 or 3, and they have not reached the full extent. And our hope is that in the next few weeks, you will reach to a master level and you have no mosquitoes around you. While on the one hand, it was very heartening to see many of you start working in your house and with your resident welfare associations. What was also very nice is there were some major areas around the city where some of our friends live, some of you live, which was flagged. And at the bottom right, you can see how the Musi River in the Toli Chowki area is a huge cesspool for mosquitoes, and that was raised. And our program with respect to the GHMC engagement is just getting started. We have worked with GHMC to get them on board, but even before we could formally complete our arrangements with them, the moment we called up GHMC and informed them that there is a problem like this, within the next day or two, you can see in the bottom right figure, photograph, they had sent people over to start spraying insecticide in the Musi River area. I hope that has had some positive impact in reducing the number of mosquitoes, and they're very much aligned with us to help us to continue conducting such activities around the city. Many other such areas have been flagged by you all, some in Nizampet, some in Toli Chowki, some in Pragati Nagar, etc., where many of our employees live. And we're actively working with GHMC to find ways to eliminate mosquitoes from these areas. There have been changes happening in GHMC for the better, which make sure that we have the full support and commitment of officers. So while all of that is going, many of you have also started working to get commitment from your presidents and secretaries or organizing bodies of your RWAs, and many have come forward. So while that is happening, I request the rest of us all to please go ahead and contact our RWAs also and recruit 4 to 5 volunteers from each RWA. This has to be volunteer driven. The mosquitoes that bring dengue live within 400 to 500 meters. They breed within 400 to 500 meters of our houses. That means that the ability to eliminate them is in our hands, and we can't entirely depend on the government machinery which is spread very thin in the current circumstances with all the public health crises that they're dealing with. So again, my request is for us all to keep up the good work, to participate actively, to share motivating statements such as what you're seeing. You all know who the most active users in the Telegram group are, but my hope is that for every little thing, we all the 85 members in the Telegram group and a few others, please participate. And that is because only when you participate, we know the strength of this program. And only when we have the strength of the program, we can ensure that none of our friends, co-workers, employees, household help is affected by dengue fever. This is a crisis. We need to act now. So look forward to all your continued participation. Thank you very much. And we will work together in the next few weeks. Also, last thing I wanted to say is we've also received several questions about what we can do to what kind of ingredients we can spray, what chemicals can we spray, etc. Those measures in every fortnight we will add starting today. We will start teaching you. We don't want to tell everything in 1 week. Whenever we help you with such measures, we also are working on procurement of the necessary ingredients so that you are enabled and empowered to actually deploy them. And that is what will take some time. But we will do it in a way that you can actually start working on them. Thank you, and over to you again, Samiksha.
Right. Thank you, Shari. Thank you very much for that insight of what work has gone. And I must say that from the previous webinar, we had received a lot of enthusiasm from the DRL team. We are so happy that the project has kick-started so well, and this energy will pass on to RWAs as well. I'll invite Professor Murthy now to just give us a brief about what the project is and what role the RWAs and volunteers would be expected to play. Professor Murthy.
Thank you, Samiksha. Namaskar to everybody. And I think I have the permission for the screen. So I'll... So can you see my screen?
Sure, sir. Please go ahead. It is visible.
Thank you very much. And what I'm going to do over the next 14 to 16 minutes, that includes the confidence intervals of 1 minute on either side, is to try and highlight why it is important to work together in a partnership mode to make a difference, which is why we are looking at it as an RWA-led community empowerment supported by volunteers, both from the DRL and IIPH on the one hand, and from the RWAs on the other. At the present moment, we all realize how effective RWAs have been in the fight against COVID. And some of the newspapers, like the Times of India, have been carrying information on how RWAs have been working together to try and tackle COVID within their own societies and with their own resources. Meaning thereby that one cannot applaud with one hand. When we clap, we need to use both our hands, and that is why in Hindi we say, Tali ek haath se nahi bajti. So you need both the hands. One hand is the government, and the other hand is the rest of us as the community who can actually make a big difference in tackling dengue. Why are we talking about dengue during the COVID times? The simple reason is we do not want a double whammy, because dengue is a mosquito-borne viral disease which has spread across the world and is very active during the monsoon period and immediately post-monsoon. And therefore, we are still not out of COVID, which is why I said there could be a double whammy. The virus called the dengue virus is transmitted to people like us through the bites of infected female mosquitoes of the species called Aedes aegypti and Aedes albopictus. Aedes aegypti is the more predominant of the Aedes species in most of the parts of India. The mosquito which causes dengue is also responsible for chikungunya, yellow fever, and the Zika virus. Yellow fever is more Africa-centric, and parts of Southern America also have it. Zika has been mostly in the Southern American region, specifically Brazil. With chikungunya, we are home to chikungunya along with dengue, even in Hyderabad. And the same measures which we can use for the Aedes mosquito to prevent dengue will also protect us from chikungunya. Dengue is amongst the top 10 conditions which has been prioritized by the World Health Organization for global action within the next 5-year plan. We see that the disease has increased more than 30 times in the last 2.5 decades, and the geographical expansion has increased from about 5 to 7 countries to now more than 150 countries. Globally, 390 million dengue infections are estimated to occur every year, of which about 1/4, 96 million, manifest clinically. A lot of them do not have clinical signs and symptoms, and therefore they are missed. India has a third of the global blindness of the manifest conditions, that is 33 million cases. If we look closer home at Telangana, we find that just in the last 2 years, there has been a 3-fold increase in the incidence of dengue, and similarly in the incidence of chikungunya in the Greater Hyderabad Municipal Corporation area. Like I said, it is only through community engagement that we can actually get rid of the mosquitoes which breed and cause dengue. We need active participation because most of the breeding is around our households or around our apartments. Shauri mentioned 500 meters, that is the longest range, but most of the times it is between 100 to a 200 meter distance. So the span at which these mosquitoes fly is very limited, which is why we also call it the lazy mosquito, because it does not go too far. And therefore, if we have measures taken at household level, we can actually make a big difference. We have numerous examples of communities working together in reducing the occurrence of dengue, and a country in Latin America, Uruguay, has become dengue free just through community engagement. And unless we look at the communities participating actively, we would not be able to make a big difference. Stay home, stay safe. That is what we've been talking about over the last 4.5 months in relation to COVID. I'd like to add another dimension. Once you are staying home, is your home safe during the monsoon season? Over the next 2 months, our monsoon in Hyderabad is going to persist, and therefore it is not a one-day affair. It is going to be there at least for the next 2 to 3 months with us. So along with staying home, we also have to see that the homes are secure. Any fever during the COVID pandemic would require medical attention, resources, and contributes to stress, because every fever, people's first doubt is it COVID? But let me just tell them that dengue or malaria is as risky as COVID, even during the pandemic times. The biggest problem is that both dengue and COVID have a very similar clinical presentation. There is fever with some of the other signs. There are differences in some of the signs, but fever as the predominant feature is seen commonly in both the conditions, which is why a misdiagnosis is possible. And if we do not give attention to both the conditions in ruling out the cause of the fever, they may be actually starting wrong treatment, or the delay in treatment can cost a person's life. So while COVID is the danger outside, we are not secure inside because dengue is the danger inside. So it is in our own interests and in our own hands to see that we are able to control the danger inside. So what we are going to look at is to try and get a handle on both dengue and chikungunya through an integrated intervention, with all of us participating and providing you the support so that action can be taken to make a difference. We need to look at all communities working together, collaborating, and acting effectively to reduce the incidence of dengue fever and its complications. We are calling it the rule of sevens, and we'll see in one of the later slides why we call it the rule of sevens. The initial project duration is for 7 months, started in July, and we are going to go into the winter, going up to Sankranti next year, by which time we would have a very good idea on what difference this sort of initiative has been made. We also would be intervening with the support of GHMC and relevant NGOs. Dakshas is one of the NGOs who's already closely working on this project to see how an integrated intervention can make a difference. So when we look at the interventions, we are actually starting off with what Mr. Sauri just mentioned about looking at sites where there is water stagnation and clogging, trying to input solutions into that. We are looking at behavior change and communication using digital technology, using mosquito repellents, not just during the night, but during the day, because that is critical for Aedes. Aedes is a day biter. It is too lazy to go out at night. It doesn't like clubbing at night. It prefers the day. And therefore, we have to now look at using repellents both during the day and the night to get rid of the menace of both dengue as well as malaria. Fortunately for us, GHMC area has much lower incidence reported of malaria compared to the very high incidence of dengue. We'll also be developing and using an app for surveillance of fever, and you would get a better idea about what would be happening on this. And there are a number of measures like impregnated mosquito nets on the windows, on the doors, hangings, looking at baits which will stop or attract the mosquitoes. So it is more like a honey trap where instead of humans, it is going to be mosquitoes, specifically the Aedes mosquito, which would be trapped there and not create problems for the rest of us. We'll also do other activities like seeing what is the density of mosquitoes, what are the types, how sensitive is it to particular insecticides. So all this would be happening in project adopted clusters. So we are going to look at certain clusters where there is a core base of volunteers as well as the RWAs who are interested to participate. And many of you would have seen that 3 days ago, we had the first squadron of the Rafale aircraft landing at the Ambala base station, coming all the way from Paris. Now, we fought the 1965 war against Pakistan using the NAT aircraft. So initially, there are certain technologies which can help in limited ways, but the Rafale brings in additional technologies. It has more missiles, and we would look at similarly more missiles like using fish, using genetic engineered mosquitoes so that they act as a mosquito matrimony site, getting a dengue vaccine. So all of these are the missiles that we would need to add on just like the Rafale aircraft has added on so many technology features. So our battle is just like the Rafale, where it will start with simple interventions, but will scale up based upon what is available and what is required. So we have a requirement that you all commit to project activities, at least for the first 6 months. And then looking at how it pans out, we would look at taking it further. There would be a lot of capacity building initiatives. We would need to look at motivating households within the RWAs, making them understand that even during COVID times, we also have to look at other conditions which can cause harm to all of us, not just think about COVID, but also in addition. We would look at interventions both at the community and household level, and all of us, including the volunteers, would join in to monitor, do random checks to see how things are developing. We would look at extremely good use of the reporting app so that real-time action can be taken up. We are setting up a control room, and this would be through the next 1 week, we would work on setting it up so that we would have all of you supported technically and logistically from the control room. Initially, there is no need for any monetary contribution. We would try and support you so that you could have seamless activities being led over the next 7 months. We are looking at an every Sunday campaign. So we request a couple of hours every Sunday. And this is what I said, 7 activities on the 7th day every week for a period of 7 months. And this should be looked at as a fun and clean campaign. Fun for the children, the grown-up children who can get together and learn while they practically do some activities. And the clean campaign is where you're cleaning all your neighborhood of the risk of breeding of the Aedes. We need to look at establishing community no fever teams. And like I said, the fun part of it is for the children to come forward, make all of us feel younger, and make us work with double the energy because they're around, which is why it's a fun and clean campaign. We would need to look around, put on our telescopic vision, and look at where all you have unusable or disused waste containers, bottles, tires, etc., and try and remove them if possible, or empty them, or whatever water collection is there, throw it off in designated closed lid bins or in closed bags. We would need to tell the women of the houses how not to collect water and not allow it to stagnate. So we would need entire communities to work together, including the women in our houses. We would, like I said, honey trap the mosquitoes, and we are looking at building locally indigenously made in India sugar baits so that we could honey trap the mosquitoes. We would also require all of you to be safe. So you have to use repellents, coils, vaporizers, sticks, applying insecticide on your end of your sleeves so that when you step out of home, you are protected. Light colored clothing and full body clothing is extremely critical. We would also help you with getting impregnated curtains, which are basically meshes, and you can just attach it to your existing window meshes, and we would work on how to see that these reach you without too much of a delay. Use the app and report what is happening. The volunteers, which would be a core of 3 to 5 people from Dr. Reddy's and IIPH, will all be together with you along with the volunteers from the RWAs. We would be providing a lot of information, organizing online meetings, provide the volunteer kits to facilitate every Sunday activities and provide the material that would be required and on reporting. It is easier for us to look at getting rid of the larva, which is much easier to do than to tackle the adult mosquitoes once they've grown. So though our structure of activities, our architecture would look at all ends of the spectrum, we have to look at getting rid of the larvae as one of the most important first steps. A number of things are going to be there in the volunteers kit, and over a period of time, each volunteer would be provided with all that is listed here, so that you do this activity with safety and do it consensuously. And we are with you, behind you, providing you all the technical support. An activity plan has been drawn up right from the 19th of July when we started this. And during the interim, a lot of activities have happened. Enrollment of RWAs has started. And today we are having the second meeting. 15th or the 16th of August, along with our Independence Day, we would look at RWAs gaining independence from the breeding sites of Aedes mosquitoes. And that is going to be our mission. Tiger Zinda hai. Our mission is still active and would continue over the next 7 months to get rid of the menace of the Aedes mosquito. We hope that together we would develop a team of dengue community volunteers, warriors, who can actually make a difference both at the water cleaning level as well as identification level, identifying the fever cases and providing necessary support to individuals who require that support. Thank you.
Thank you, Dr. Murthy, for giving us an insight into the project. I would like to mention it here that he mentioned about a lot of steps here. And I want you to note that we will be hand-holding you all across the 7 months and slowly introducing these steps so that it doesn't become overwhelming to you all. The pyramid he showed clearly mentioned that we'll start with few actions which are to be done at our own individual level, then go on to a RWA level, and then to a bigger community. So, and these efforts have to continue. We'll keep adding new efforts, but that doesn't mean the previous ones have to stop. These have to continue for a longer period of time if we want to get a longer duration and getting rid of the mosquitoes. So with that, Dr. Murthy also mentioned that although we are aiming for no fever, but we may still have fever cases, and our project would like to support those patients and the RWAs in kind of guidance what should be done. So going ahead with this, I'll request Dr. Bharat to join and share with us what we can offer to our RWAs and what they should be doing in case there is any fever noted in their community. Dr. Bharat, please.
Right. So thank you for inviting me for this presentation, and good afternoon to all of you. While we are today gathered here to discuss about COVID-19 and dengue in the current context, what we would like to look at is how does community preparedness make a difference to healthcare delivery, and what role does it have in ensuring that we get equitable healthcare. And I think that's where the RWAs have a major role to play. So we'd like to present a case study to you. As Professor Murthy mentioned that while COVID-19 is outside, we may have dengue inside. We may face two outbreaks. They have very similar presentations. They can be dissimilar treatments. And our healthcare system is currently working at the extremes of capacity. So there's hardly any free capacity available. So I wanted to share a case study with you on how community preparedness or coming together as a community, maybe at a RWA level, can make a difference to healthcare delivery in the extremes of circumstances. So we are an NGO. We've been working in Hyderabad for 6 years now, and our goal is universal healthcare. And we've evolved a method by which you can deliver healthcare in the most extreme circumstances uh, if the community comes together. So this is a case that I would like to present. Uh, this is a lady who was abandoned, and she was attacked by street dogs, and she had nothing to get her health care. But over time, the system that was developed came together as a community, ensured that she got healthcare, ensured that she was admitted into an old age home and taken care of. And this has been the case of a community coming together and delivering for over 40,000 patients now, over a lakh of treatment sessions through the last 2 years. And as a clinician, I have seen this project has made a lot of difference in healthcare delivery when the community comes together. And that is what I would like the RWAs to consider as their role in healthcare delivery. So we did an analysis of this project, and we realized that the efficiency of the healthcare system, the cost of healthcare delivery immensely improved if the community participated in it. So over the course of 2 years, we saw that healthcare costs fell down to almost 16%. Of course, this was in marginalized groups, but that is the level of efficiency community involvement can bring to healthcare. So just as Professor Murthy was suggesting that communities should get involved in preventive healthcare, I do believe communities have a huge role to play to provide treatment for their community members. So, what did we learn through the course of these 2 or 3 years where a community was brought together? We felt that these were some of the changes that came in when the community drives its healthcare. What we've seen in this project was there were standardized medical protocols which were followed across clinical units. So in this project, almost 10 different clinics and hospitals were following the same medical protocol uniformly. Also, because the community came together and provided resources, there was a real-time quality check. So the standard that we followed was the quality check would happen before the patient leaves the consultation room. So that was enabled. And thirdly, some redundant and unused resources in the healthcare system. Of course, with COVID-19, healthcare capacity is at a challenge, but otherwise there is healthcare capacity available which communities can tap into. And if you come together as a community and access healthcare as a community, you can get a much better deal from the healthcare system. So this is the simple path that we would recommend communities set up for themselves. And when you come together to access healthcare, make sure you have good primary clinic access. And this is the ballpark of the healthcare system. Your community should have access to a good primary level healthcare. And in our project, we noticed that 95% of the patients we could deal with in the clinic. They never needed to visit a hospital. And at the end of 2 years, the maximum impact of the project was at the primary clinic level. It was not at the hospital level. And our patients saved almost 2.4 crore rupees in out-of-pocket expenses. And that because we had a strong primary healthcare system. Secondly, this clinic worked in tandem with the hospital, not as separate fragments. So the clinic coordinated the care of these patients when they needed to go to hospital. The clinic doctor communicated, passed on the information, the care was coordinated, and at the end of hospital care, the post-hospital care was again done in the clinic. So that coordination unlocks another 60% efficiency in the healthcare system. And the high-end healthcare, maybe tertiary care surgeries or ICUs, they generally have free capacity other than the current times we face. And if you come together as a community, you can tap into this and you can explore ways of group insurance cover. So, what are the three things that RWAs can bring to the current scenario? I think the first thing you can bring in is community education. So be aware of what it means to have dengue in your environment, what it takes to prevent it, and how does it behave, and share this knowledge with your community. So you should be aware of what happens after a mosquito bite, how that it has a fever phase which lasts around 3 to 7 days, and after that, as the fever subsides, the next 2 days are very critical, because this 2 days decide whether you go on the path of recovery or you develop complications. So the community should be aware, educated through the RWAs of how the fever behaves, so they can behave appropriately in each phase. There should be a community level planning of what you would do if you have a case of fever. And you should consider both possibilities, because there's COVID-19 outside and dengue virus inside our homes. So, in our current scenario, community education to isolate the patient, using a mosquito net or repellent to make sure the transmission of dengue virus also doesn't happen, adequate rest, hydration, maybe a paracetamol tablet. You can probably watch for 6 hours or 8 hours. But after that, if your fever persists, you should encourage community members to seek help, preferably through telemedicine or a fever helpline. Probably you will be discussing your symptoms and signs with the clinician, and some diagnostic tests may be ordered, which needs to be facilitated at a clinical level, at a community level. What we need to realize is that in all these diseases, whether they are infectious or they are related to lifestyle, we share the environment and we share the lifestyle. So these are better dealt with at a community level. The third education that we would like you to spread in your communities is use of these group of medicines called NSAIDs. So this is a study we did out of 182 dengue patients who visited a single clinic over the course of last year. And we noticed that almost 30% of them had taken this group of NSAIDs, which are your basic painkillers like diclofenac, ibuprofen, before they presented to the doctor. And these drugs can increase the complications that the patient can develop. So there has to be a community level awareness that you would take any medicine only in consultation with your clinician, or you would only use paracetamol. The second thing that communities can do to increase their healthcare access and healthcare quality is to very strong primary care system. Like I mentioned in this project, we noticed that up to 50,000 patients were seen, and 95% of them were dealt in a clinic near their home, and they never even had to visit a hospital. And that is the best way we can deliver effective healthcare to our community. So this is something we are going to try and attempt through this project for dengue and fever over the course of time, where in these 7 days, the first 7 days, you will be able to reach a helpline. Of course, we would encourage you to access your physicians with whom you're already in touch with, but the helpline can give you supportive information and help you coordinate further care. The second part of the helpline will be, in case you don't have a regular physician, we will try and identify clinics and physicians near your locations with whom this protocol would be shared, and you would be able to access protocol driven systematic care in those clinics near your homes, so that if you take care of yourself in the first 7 days of fever, the complications would reduce drastically. So facilities would be available for diagnosing various types of fever, monitoring patients with dengue, and making sure that if they develop any warning sign, prompt admissions are advised to hospitals. So this is what would be the advice to follow at home with fever. Assure adequate rest, to drink plenty of water, make sure you use mosquito repellents, probably paracetamol, and contact your physician. What is very necessary is to make sure that people do not get dehydrated. Because with dehydration, the risk of complications in the critical phase go up many-fold. So these are some of the symptoms that people have when they develop the critical phase of dengue, which is probably bad bellyache or bleeding tendencies. But this is not an area we want to venture into. We want to make sure people are hydrated well so they avoid the critical phase. Thirdly, what we would like to do at a community level is to establish a monitoring system. So where at least a nurse level monitoring is established every 3 to 4 days, so that we identify very early signs of people who would be developing complications, so that early intervention can reverse entry into the critical phase. So in these 3 steps, we can try and make sure that community level primary care can make a lot of difference. So the third thing I would suggest is, apart from the preventive measures that you will learn and implement as a community, please ensure that you are prepared for illness. That as a community, you have made decisions to the helplines that you will access, that you've made decisions about how people would take care of themselves in their homes, how the community would support them, probably with diagnostic tests, medicines, equipment, and if needed, admissions to hospitals. And I do strongly believe that these are things we best deal with as a community and not individual. Thank you.
Thank you, Dr. Bharat. And that was very useful. And I'm sure that everybody has noted that please, in case of fever, paracetamol is safest. Don't self-medicate in these times. It can lead to any other complications. And the best way to go ahead is through teleconsultation to your known doctor or some other doctor. We, and in a project, are trying to build a mechanism where we can help you and guide with your initial doubts and suggest you what you should be doing through our control room. So for that, we will need to know our volunteers, the RWAs, which we are engaging with, because the whole activity to build up the whole mechanism and also guide you to any potential partners in case you do not have your own clinician, as Dr. Bharat said. You will also need to do some mapping of where all our volunteers and RWAs are coming from. So I would emphasize again, we would like your commitment, and we would like to know who all are with us, and then we will take this project with your participation, supporting you, and make it a success. Thank you, Dr. Bharat. I hope people will have a lot of questions regarding what the project is going to look and what they would like to contribute to a project or receive from you. In the continuity of that, I'll request Dr. Rajan to please join us and take it from here. This is an open forum now, and we would request participants to raise questions either in the chat or raise your hands. First, Dr. Rajan will take up some questions which are already sent to us through Google Forms or in the previous communications with our volunteers. In the meanwhile, Dr. Rajan takes up those questions and direct it to our panelists. I request all the participants and attendees, please write the questions in the chat box or raise your hands, and we'll call you one by one to ask the questions directly. Over to you, Dr. Rajan.
Thank you, Samiksha. Yeah, thank you, Samiksha. So I think this is exciting time for everybody. Question answer session. I think this is what people have been waiting for. First, I will just take some of the questions that you have raised earlier, and then go ahead with the people who have raised their hand and allow them to speak. So my first question is to Samiksha, and this is, what extra help are RWAs going to get in this project? Though Dr. Murthy has specified that, but if you can quickly repeat that, that would be helpful.
Right, great. So this project and the prevention from dengue has three main categories. One is the communication bit, which is to raise awareness and what you should be doing and the feedback regarding it. Second is which will require some material where you will have to do things together. Like Dr. Murthy was talking about certain materials, insecticide impregnated curtains, temifos in water collection areas, or the safety measures that you have to take when you do those control measures, and other equipment or specific products that you would require. That is material related aspects. And the third part is the feedback. What you will have still after doing a lot of activities, you will have points where you will need some outside support. Either it is for fever case management or engagement with GHMC to deal with large water pools. So we have these three pillars. In all these three pillars, we'll be supporting you. For example, for communication and awareness, we are already developing material which will be coming to you all in a pulse manner. It will be a mix of videos, a presentation deck, what we are doing, infographics, and all other modalities. When I'll take my presentation, I'll show you what we have planned for next 2 weeks. So all the information material, it will flow from the volunteers to the RWAs and from RWAs to the residents. Regarding the products which we want to be to promote for use for self-protection and the protection of your community, those products will be distributed to the volunteers, which are project volunteers, as well as the RWA volunteers. These products are two in nature. One is again for your use at households, and the ones which are used for the use of the community, like temifos or sugar baits for the open areas or potential breeding sites. So the ones for the community will be given to the volunteers, RWA volunteers, and they should be using them every Sunday as we are proposing. The ones which are for the household use, these for now, we will just distribute to the volunteers. We request them to use them. And if they like it, if they see the difference in mosquito biting pattern, we request them to promote it in amongst their residents. From the control room, we will be able to facilitate the purchase of these items for all other residents. As of now, we are not planning to distribute it to all the residents. This will be just for the volunteers. So this is from the product perspective. Lastly, the feedback and the mechanism of liaising between the partners. We'll have some other NGOs. As we go forwards, we are thinking of also partnering with some waste management NGOs who can come once in a while to your community and collect all these waste which is being produced and a potential source of collection of water. So all these ideas are in the process, and based on what relationship we develop with you, we will try and link you with these NGOs. So the control room will be in the center. If you have a fever case, if you have any doubt, reach out to the control room, we will direct you. If you have any problem with where you need GHMC's engagement, reach out to us. We'll try to facilitate, and we'll also provide you feedback and update you with what action has to be taken. It will be a to and fro communication system through the control room and other NGOs. So remember these three pillars, and we'll try to support you in a proper manner, and we'll guide you all along. We'll not leave you alone. Every 2 weeks, we'll guide you what we shall be doing in the next 2 weeks, and also give you feedback on your specific requests. I hope I've answered what we are going to support them with.
Yeah. Thank you, Samiksha. That was very elaborate, and I think a lot of doubts will be cleared on the nature of the project now. This next question is to Professor Murthy. Sir, the question is, how different is the project No Fever when compared to previous efforts of NGOs and government as well? And what is the goal of the project No Fever? I think that you have said earlier, but you can just specify how different the project is from earlier projects.
Well, the earlier projects, if you look at it, were either government-led or NGO-led. There was no coordination with the end recipients of the information as well as activities. And the end recipient is the community. All of us are living in a community. So it could be our immediate neighborhood, it could be a wider neighborhood, but we are all within a community. And unless we coordinate what each of us can do to improve, it will not be sustainable in the long run. So when we look at this project, we are looking at an investment which is going to give us sustainable returns, because communities through the RWAs, as an example here, would then take up the activities. There is ownership, and then in the future would use this as a mechanism to keep their community free from the danger of dengue, malaria, or any other mosquitoes in this instance. But then this grows up. So next on the list is house flies, which lead to a lot of diarrheal diseases and also cause food poisoning, also cause gastroenteritis, diarrheas, admission to hospital, dehydration, fever. So all those conditions are also there. Obviously, you cannot tackle everything in one go. So we are starting off with this, and incrementally, there would be more and more ownership, which we will all work together for the common good. So that would be what I would say is different from the earlier initiatives, which are either government-led or NGO-led, and the community was just a passive beneficiary. We don't want the community to be a passive beneficiary. We want your voice to be heard and you to own the activities of having better health in your own hands. That's from me, Raj.
Yeah, thank you, sir. And that is, you have distinguished the specific nature of this project. Um, the next question is regarding, and this is a very common question across the Telegram group. Also, this question has come up on multiple times. And I'm just taking one of those questions. Areas like Toli Chowki are known for mosquitoes since years, and government effort have proved not very successful in handling them. So what is the plan for such breeding hubs? And I'll take this question, and then I think Dr. Jairam and Professor Murthy can add on to that. See, the whole for any effort to be sustained, and this has been the story with vector control disease program right from the start, any effort to be sustained, community participation is very important, and there has to be a coordination between multiple agencies. So for example, sewage disposal, um, then the uh, GHMC entomology wing, waterworks, roadworks. So there is multiple integration that is required, coordination that is required, and the effort. And this will only be possible if we have volunteers, community members who are awake, who are conscious, and who are asking for it repeatedly. So what we are looking at it is sort of providing that coordination platform, which will then, the demand from the community which will come up will then be passed on, and there will be some mechanism to monitor and assist GHMC in fulfilling these things. Now coming to the specific questions, for places like Toli Chowki, it has to be again be an integrated effort. The neighborhood has to take care of first that there is no plastic disposal, there is no uh, system which choke our drains, and which lead to the mosquito. Then GHMC has to come up in terms of sewage management and all those things, and the vector control, the herbicidals and vector control management. So this sort of coordination is required, and we are hoping that we will move forward to some extent. We have already seen some amount of success in the past few 2 weeks of time that we have been going on, but that is not a victory. That is just a start. We'll have to go a long way in terms of doing this, and residents will have to take initiative in terms of what they can handle at their level, and what they cannot handle at their level will then have to go to the authorities to handle, and we can play the role of coordination. We can provide the coordination platform. Um, so I hope I have answered that question. This was a very important question. Sir, Professor Murthy, Professor Jairam, would you want to add anything to this, sir?
I think Dr. Jairam, from his experience, can add some.
Rajan, you have answered the question very well, Rajan. Only one thing is, wherever there is a water stagnation, there will be mosquitoes will be there. So the prime responsibility of the community is just to see that there is no water stagnation in around their community or the houses. That is the number one thing. And the government of Telangana and in the Vidya Bharati also, they giving a repeated appeal to all the citizens. Every Sunday, you should work for 10 minutes. Apart prior to our campaign also. So only thing is just to create awareness among the public that all the water that is stored should have lids. Otherwise, if the water is open, you have to drain the water and again fill the container. That is this thing. And the best thing is to see that the water is not stagnated. If you are unable to drain out the water, please take a photograph and send it to us so that if large bodies of water are there or if they are unable to prevent drain it by the pump or water we are giving, we'll escalate it to the GHMC authorities. That's all, Rajan.
Thank you, sir. Uh, so next question is to Professor Murthy, and this is regarding insecticide resistance is a growing concern, and what needs to be done about it, how to handle the insecticide resistance.
Yeah, so this is, of course, the major worry globally, which is why, though we had the malaria program from 1953 as a pilot and 58 from the main project, uh, we were successful for the first 5 years. By 1963, people thought that that would be the end of malaria. But unfortunately, that's when the resistance to DDT started. Remember, just like we think we are smart, but the insects or other parts of the animal kingdom, which have a very small intellectual capacity, most of their activities are autonomous or what we call a spinal level. And resistance is one sort of survivorship mechanism for an insect. And therefore, whatever you throw at the insect, over a few generations, the insects will start looking at messaging themselves for the future generations to bring in resistance, which is why we should not depend upon one particular stage of the mosquito cycle when we are looking at insecticides. So if you're looking only at an insecticides for adults, which is what DDT was basically doing, then it is bound to have failure after a particular time. And all these insecticides like DDT, which are sprayed in a large amount, are not free of harm. They also can create harm to the human beings. Therefore, you look at some things like larvicides, and the larvae can actually remain for more than 1 year dormant without becoming adult mosquitoes. So you have plenty of time to use an insecticide there. And we find that larvicides, there has been less resistance. It's not that it has been no resistance, but less resistance compared to the adult mosquitoes. And that is why we actually put together a series of chemicals which would act against the larvae or do not allow the pupae to hatch or against the adults. And unless we put all of them together, one particular insecticide at one stage of the mosquito life cycle is not going to help us. Going forward, insecticides are only a short-term measure. Insecticides can never be a long-term measure. We have to look at use of, like I use that term, mosquito matrimony. Just like Bharat matrimony, Telugu matrimony, mosquito matrimony is something which is coming up, where you have sterile male mosquitoes which breed with female mosquitoes and do not have the mosquitoes which are born to them cannot actually have, they do not become carriers to viruses like dengue. And that is something which we need to work at. The other thing is, instead of just chemical compounds, you're also looking at some of the fish, either as larvicides, which is what Gambusia fish was, and there are also bacteria which actually ingest the larvae and get rid of the larvae in collections. These are more costly ventures, but if we have the support from a wider community um partnership and from DRL and other corporates, we could also look at some of the other things becoming a reality so that we just don't depend upon insecticides, all of which over a period of time will develop resistance. Having said that, bottom line, at the moment, Temifos for the as a larvicide is quite effective, and we should use that. And against the adults, we would either honey trap them using sugar baits, or we will have to use insecticides, which are called indoor residual sprays, or the impregnated meshes to which these stick and die. But like I said, all of them are in the interim, maybe 2 years, 5 years, 10 years, but ultimately we have to go in an ecologically beneficial manner.
Thank you, sir, for taking that question. Very important question and very well explained. Next question is for Dr. Bharat. And the question is, what is the main reason for deaths happening on dengue infected patient? Is it only due to platelet count going down, or is there anything else? And how to avoid it if the patient is far away from hospital?
So, in most of the cases, dengue infection is mild. It doesn't produce a lot of complications. But there are some instances where it can trouble you a lot. It could be because you're getting it for the second time. So the altered immune response from the first infection can actually produce an adverse immune response in the second infection if the strain of the virus is different. You could have more complications because of an already ongoing process in the body. So, small children during pregnancy, old age, or other comorbid conditions. But the major risk to us happens because of two things. One, we do not hydrate well. That is very, very critical. In the first few days of fever, especially the first 3 to 4 days of fever, it is absolutely critical that you maintain the water level, the water in your body, and you don't lose it. If you don't hydrate well, that increases the risk of complications manyfold. The second reason why we see a lot of complications is because oftentimes, as is the practice in our communities, we self-medicate. And there are medicines that could predispose you for higher risk of complications. So these are some of the factors that would lead to a dengue infection causing a huge amount of complications and putting us at risk. The levels of platelet over time have lost their importance. Earlier, there was a lot of stress on platelet transfusion to maintain the levels of platelet, but that is not the trend now. We know that that is not the reason for why bleeding occurs. Platelet and drop in platelet count is taken as an indicator that the patient may develop a severe infection. So that is the role of platelet count.
Thank you, Bharat. My mic was muted. Next question is on the sugar bait, and everybody wants, the participants wants to know about what is actually a sugar bait, and how to go about it, how to use it. So just to sugar bait is based on the habit of mosquitoes in terms of after mosquitoes, like everybody else, uh, requires energy to feed, fly, and do its activities. And we are capitalizing on this habit of mosquito. So what we do is with the sugar, so fructose and sucrose based sugars, fruit based sugars, you mix insecticidals, and the mosquito comes for this feeding, and this feeding is very frequent. After a bite, mosquito requires a feed. After the larvae they mature into a mosquito, they require a feed. So there are multiple times that mosquito requires a feed, and they look out for this sugar baits, the sugar solution. Normally, naturally, it is flowers and the nectar which is the source of this sugar, but here we are trying to trick them into another uh, bait which is mixed with insecticide, and that is what is a sugar bait. Currently sugar baits are not readily available in India, and that's why, as a part of this, though they have been used globally in control of mosquito, especially for Anopheles mosquito, and in Brazil and other places even for Aedes mosquito. So we are trying to see how we can get it into, and we are trying to identify or manufacture, have some homemade uh, manufacturing, or probably identify a firm to manufacture it and to supply it to RWAs. I hope I have answered the question about sugar bait. The next question is to
Rajan,
yes, sir.
the sugar baits are outside the house. I think that also you need.
Yeah, yes, sir. I think
It's
you
not
can.
inside.
Yeah,
Yeah, so you want to attract the mosquitoes and keep them outside the house rather than keep them inside the house. And therefore, corridors, corners of the doors, these are places where we try and bait them or trap them. They come for the sugar, but get tricked into ingesting the insecticide, which then acts on their nervous system and ultimately kills them. So that is the principle, but it has to be outside the house, not inside. Over to you, Raj.
yeah. Thank you, sir. So the next question is to Samiksha. And Samiksha, you have already shared guidelines, but the question is there a plan to develop a guidance document with the local communities that can help them handle this project? And I think part of it has been developed, but you can take that question.
Right. As we said earlier, that we'll be going in a cascading manner, stepwise manner. The first thing you may already have received is some kind of information in the form of enrollment form, where we wanted what RWAs are requested to do. At the next step, today we will be telling you what you should be doing at your personal home and for your personal protection. And the next one, we talk about how to use Temifos, and we'll give you the products. So the guidelines will be simultaneously will be circulated at the same time. Yes, whatever we are asking and requesting you to do, you will get a support material alongside. It's just that today with this webinar, we are kind of kickstarting and identifying who all our partners going to be, and then structure this mechanism. And from here on, you will frequently receive material from us, which should not even overburden you, which should be doable and practical. Thanks, sir.
Thank you, Samiksha. Yeah,
Rajan, I think there is one more question on those insecticides from Sauri. So basically, he's asking about kerosene and oils.
yes.
So, kerosene and oils we don't use for fresh water, and around the house, most of it is the fresh water, or we don't want it to come anywhere near drinking water sources. So what we use kerosene and oils is for the outdoor polluted water supplies. And I think initially we would be concentrating around the house, if I'm correct, Dr. Rajan.
Yes, sir.
I think we can look at if there are collections outside the community which are stagnant water, then definitely putting a film or a layer of kerosene or any oil, because oil smeared on the water sees that the air tubes of through which they need to the larvae and pupae need to breathe, those are cut off, and therefore you kill them. So that also is useful for stagnant water, but procuring kerosene, oil, I think it would be better that we look at the GHMC doing that, and we could ask Dr. Jairam to help with that.
Sir, what I will do is I will quickly share a small presentation, a quick one, to take this question, because this is also a question which has been coming up again and again. Um, Basically, lot of people, I hope like you can see my
Yeah,
screen.
it's your screen.
Yeah, can you?
Yes.
So a lot of people have been coming about chemicals. They don't want to use chemical. Is there anything natural? So there is a mixture of karanja oil and neem oil. So 70% of karanja oil, karanja is the papdi plant, which is seen here, and then you have the neem plant. So the 70% karanja oil and 30% neem oil is also a good larvicidal, but definitely chemical larvicidals are better than the natural ones. So temifos and difluorobenzoron are much better, but even these are effective almost to 80 to 90%. The chemical ones are almost 99, 98, 99% effective if used properly. Um, but coming to the oil balls, I'm just adding on to what Professor Murthy said. If you have kerosene, you can use 10 ml of kerosene for per square meter of surface area. You can also use the mixture that of the oil that I told you earlier, and that is 20 ml per square meter surface area of a water body. Uh, if you are looking at fresh water, then Bacillus thuringiensis, it was found in Israel, and this is a very safe alternative. It is safe for your pets. It is safe for aquatic life forms. Um, it is very safe alternative, and this can be used even in small ponds. If you have a lily pond or a lotus pond, you can use this here. What I have done is I have shared the information, and it is available. Uh, it is available on Amazon also, by Sumit Chemical Mosquito. So you can just search for that. More information is there in the links that are being provided under the presentation, and this presentation will be shared with you. Uh, Inside spray, again, ideally inside residual spray is basically pyrethrin based compounds, delta methrin, sulfurethrin, alpha cephomethrin. So multiple compounds are used as indoor residual spray, and also used for treating insecticide treated bed nets or window nets here. But there are people who are not comfortable with that and are looking at natural insecticide. So again, citronella oil and pyrethrin combination is again a good botanical insecticide, and this is again used in organic farming also. So just wanted to share some of the things. Temifos we will be providing, but in case people are interested in Temifos, we will share you the number of the supplier also later on. Okay, so I'll stop sharing the screen. And um, Samiksha, are there any questions from attendees? Any hand raised? Anybody wants to ask any question? Or
Rajan, I've answered a few on the chat, but I guess we can take some more questions after we list the
yeah, after
activity.
you list the activity, yeah, go ahead then.
So, we will now just proceed. We'll have another round of question answers, but let's just go ahead. Uh, Before I talk about what we are supposed to do in next 2 weeks, quickly I'll invite Yatish and Joshua to just share briefly one of the volunteers' experience, what they have done, and how they would like to take it with the RWAs. Over to you, Yatish.
So I would invite Joshua to share the work done by our volunteers in last fortnight or so, and Joshua will be sharing some of the visuals as well as a video of one of our ACE volunteer. Over to Joshua. Joshua, you have to unmute yourself.
I guess Joshua is taking time to put up his video.
Right. Am I audible now?
Yes, Joshua, please go ahead.
So first up, I just wanted to say thank you to the first, I'd like to call them the lead volunteers, because they were the ones who stepped up and they led from the front. They kept the engagement going around the group, and I just wanted to take this time to put their names up on the screen and thank them for all that they've done. So just to add on to what Sauri had mentioned, one of our volunteers, Mr. Benjamin, he had gone and found out that there was a hanging garden which had a balcony with water that was stagnant there for a long time, and there was a lot of questions that was asked about how do I clean it, and you can see in the images right here on the right with him trying to unclog the drain. So only when our volunteers began going out there in the field, even we began to realize about the nature of all the scenarios that one could face. So thanks again to volunteers that are here. And one of our volunteers, Amjad, I'm sure you would have, had spoken about how he used the platform to flag a concern and address it. And as Professor Rajan also said, we have a long way to go, and this is just the beginning. So I just like to play a short clip from Mr. Amjad's video that he shared.
For the success of such initiatives, we need to have a very broad thinking. We need to think out of the box. We need to selflessly submit ourselves for such initiatives to really make it possible. So once this project No Fever was actually advertised by Sauri, the first thing came into my mind was Tuli Chowki and the problem of Tuli Chowki. There are so many jokes around on Tuli Chowki, particularly with respect to mosquitoes. So there is just one joke I would like to close. Toli chowki hamara hai, ye machharon ka nara hai. So you understand? So that much is the impact of Toli chowki. All the rents are down because of the mosquitoes in Toli chowki. Really. Anyway, so I would like to close this talk, and thanks Sauri, thanks Joshua, and thanks all experts of IIPH. It's a wonderful, great effort, and I would like to do.
That's about it. Thank you, Amjad. And that was just a brief glimpse of our volunteers and the passion with which they continue to support. Just to reiterate here, our No Fever group on Telegram is public. You can just download Telegram, go right ahead, search for No Fever, and join the group, join the discussion, and join this movement. Back to you, Samiksha.
Thank you. That's interesting to see how volunteers picked it up within 2 weeks of our talking to them. And for the rest of the audience who have been here, we started it 2 weeks back, and we gave them a to-do list, which they worked and tried their hands on. And similar kind of activity we are going to talk about now. And I would just share my presentation here and take you through what we want to do. See, there's a whole spectrum of things. And we have a lot of questions coming through what insecticide to use, what to do with water bodies. But what I suggest is that we start with what we have in our hands. We always forget that the first thing which is in our hands is us and our house. So our team together have put up certain levels for you to check what your safety level is for dengue. So level 0, where most of us are before we get into this project, is that we are being exposed to mosquito bites during day for dengue and during night for malaria. Level 1 is when we start protecting ourselves first, start taking personal protection measures like using coils during the day and using some sprays on our hands or ends of the clothing that will come to. That is level 1. First, try and protect yourself there. Then look at your home. Is it safe from Aedes and other mosquito? Then the residential colony and the overall neighborhood. We have these levels of safety. While 0, 1, and 2 are at a personal level. So we would engage, we would want all of you to start at a personal level, but being volunteers and being resident welfare association representatives, it becomes a more responsibility comes on to you, where you have to also work for level 3 and level 4. Believe it or not, it has been shown in many countries, it has been successful, but you can live safely and comfortably without the mosquito menace and without their disease causing bites. It is feasible. So what should we do? So first, as I said, there are a set of activities we think we should do as individuals. So I put them in the bucket of do it yourself. And there are other set of activities which you as a group should be doing it, and that I call it as do it together, right? So do it together in that, spread this information, spread the education to all the people, the family, the other residents, neighbors. Try to make your RWA premises safe, and then try to make your RWA neighborhood environment safe. So the specific tasks for everyone for the 2 weeks to come. And maybe I would suggest that do it yourself activities, please, you can start it today itself because it's fresh in your mind. So what we should do, that share it with your family members. Share the importance of controlling the mosquitoes and killing the mosquitoes and be safe from any kind of fever, first with your family and close friends. You can share that with your social media, through any social media portals. The material, as we close this webinar, some of that will reach you on your phone numbers once we have all your registrations. Then please look for the surroundings. Do you have any breeding sites? Start with your home. While you do that, I'll advise that wear full sleeves, because you will be looking for the areas where the mosquitoes will be active and you would be prone to any kind of biting at this time, dengue bites at this time. So just take that precaution. And also, if you are stepping out of the home, take the precautions, all what are being recommended for COVID also. Keep yourself safe first. So then what are we supposed to do? First, in your house, check inside your house, in your balcony, in your corridors, in your building. Even the tubs, we keep them filled for weeks. We think that the water is drained or they are empty, but you'll see there will be a spoonful or just a little bit of water left in that tub unattended in your backyard, and that will be enough to breed the mosquitoes. Look at all possible. Any beer cans you have kept that you will throw them after 10 days or once in a month, you will see there will be some water collecting in that, and if you really look into it, there must be some larvae breeding in it. So first thing today, just check for your house, how safe is your house of any breeding sites. We encourage you that you join the Telegram group, which Joshua has already mentioned, and share these photographs with us and how you cleaned it and what action did you take. It will motivate everyone around you to learn, and also note certain areas which may not come to my mind, that I should look at a tray under my fridge, or I should look at under my water dispenser, or I should look at my roof and the section where the rainwater collects and then it stays for weeks to go. Do remember that when we are talking about any water collection, the water collection which stays for 2-3 days and gets drained and dried is not of that much concern, because it does not allow the mosquito cycle to complete. But wherever the water collection stays there for more than 5 days, that is of concern, right? So pick up those areas. Once you identify such areas, please drain them, dry them before using the utensil or the container again. Try to do this activity once in a week. The mosquito cycle is such that the larvae to adult takes around 1 week's time. So even if you manage to clean these things once in a week, that's why we say every Sunday. Even if you do this activity every Sunday, you will keep your house safe. So to Sunday being today, so you have to start today. While you search for things in your home, please, you will find a lot of such material which is useless and which we think that we will throw later. Once we collect 10 bottles, then we'll sell it to Kabadiwala. But in this process, what happens is we just keep them for weeks altogether. So please collect all this material, throw it, or if you're not throwing it right away, put it in a bag and close the bag's mouth so that the mosquito cannot enter inside and breed in these bottles or these cans. Whenever you throw a bottle or container, close the mouth of the bottle in a container, then throw. And just remember, throwing it outside in the main community bin is not going to help. If you throw your bottles there with open lids, monsoon water will collect in that, you will have mosquitoes collected in that, and then they will fly back to your home. So it's not just inside, you have to develop a proper mechanism of throwing these material. So start identifying that material today and dispose it or collect it in a proper manner and then throw it properly. Next, you'll see mosquitoes coming in. The mosquitoes don't just come in the night. The ones that come in the night are the ones which are spreading malaria. The ones which come in day and bite you during the day, they are the Aedes mosquito spreading dengue. So try to keep your doors and windows closed most of the time. If you cannot close, we want to leave them open. Use window meshes as far as you can. And there are ways that in the subsequent steps, we will show you that you can have insecticide impregnated window meshes or door meshes, or you can just put them as curtains on your windows and doors, which can kill the mosquitoes who are entering or the mosquito who rest on those dark areas behind the curtains. So that will come as we go along. But in the meantime, try to keep your doors and windows closed during day as well as night. And inside your home, use repellents, the coils and the vaporizers to kill the mosquitoes or push them outside. Whenever stepping out, ensure that you wear full-length light-colored clothing and use protective sprays and lotions to repel mosquitoes. A lot of such lotions are available and sprays are available and safe on skin. Even pregnant women can use it at a lower dose. We will provide you with those details and use it every day. This is something which has to be done every day. Prevent entry of mosquitoes and stay protected yourself. This is an activity to be done every day. So once you do it, you will be surprised that you will find mosquito breeding sites. All our volunteers were surprised once they start looking at, they could find at least 5 or 6 breeding spots in their homes where the mosquito can breed, and some of them even could take a picture of larvae breeding in their backyards in their pots. We love gardening. So let's start checking out, you will realize how unsafe environment or houses we are living in. Please share the photographs, and we'll also give you a checklist which can help you to do all these activities. So this is for your do-it-yourself activities. Just a few things to look at. Bottles, which may appear waste to you, are basically danger. How you throw your material, even your flower pots, plant pots. So if you put a lot of water in your pots and the layer of water is formed above the soil, that can also breed mosquitoes. The trees under your pots, water under on those trees can breed mosquitoes. Your money plant pots, you need to change that water. Open tanks in your roofs, big tubs in your house. The drains, a small drain where the pipe drains from your roof and that gutter, that if water stays there every time all along the monsoon season, that is breeding mosquitoes, just little bit. And how many of us have looked at the refrigerator trays under our refrigerators, if mosquitoes are breeding? So that's what my suggestion for today and for Sundays to come, for every Sunday to come. Now going to do it together. What we should do these 2 weeks. I'm repeating it again. If you want to use do things with for water collections and use Temifos or insecticides or oil or sugar baits, if you reach out to us, we'll help you in doing that. But we have planned it in a systematic manner from 15th August onwards, so that we'll be able to provide you some material as well. But you are more than welcome to venture into those social activities also. But from our side, what our recommendation to take it in a stepwise manner and take it to the larger community. See, not just like making your home safe will not make you safe. Your neighbor's house should also be safe. Your neighborhood has to be safe. So what we propose is, while you make yourself safe, your house safe, and look out for potential breeding sites around, also share this information with other residents. As a resident welfare association representative, now I call for a leadership role in this Do It Together activity and volunteers to support your RWA leaders. to identify volunteers and make no fever teams. And these no fever teams can be of adult volunteers as well as students. A lot of places these students have been active leaders and have led to the programs and control activities every Sunday. So that's a suggestion Dr. Murthy also gave. So just start communicating about this project to your team. Make a communication plan. I'm sure each one of you have ways of communicating to your residents, either through written material or through WhatsApp groups or some video conferencing. We'll leave it on to you how you do it, but we will definitely provide you with what information on what day and what month you can really share with them. You will see that flow chart in the next slide. So we'll give you that material, and we are happy for any kind of feedback and questions regarding those material. I'm aware that today we did not talk too much about what dengue is, what the mosquito characteristics are, what control measures have to be taken. That was purposefully done in the interest of time. We will be sharing a short video with you, which will be a 10-minute video, which describes all these activities, which was by Dr. Rajan, which was taken in last webinar. We will just cut that clipping for you all, and you will have all those things detailed out as a follow-up of this webinar for detailed understanding of the disease and the prevention measures to be taken. Apart from that, you will receive a lot of infographics as well, so that you can share with all your resident members. Dr. Bharat has already talked about how we need to address the fever issues during COVID-19 pandemic. Please make your residents realize the importance of it during this particular season, and do it yourself and share the experiences with your residents. Your residents will become part of your team only when you do it yourself and they get aligned with your experience and they relate to your experience. So what is the plan for next 2 weeks? It seems very crowded. Please don't get alert with that. No, don't worry. It is very small steps, very simple steps, which we request you all to do as a leader. So for every day, we have put up a chart, and it's simple. Like today, as I said, educate your family, check how safe your house is. Monday, just share the information with all other residents. You will be given 1 or 2 infographics on Monday. Read it for yourself, educate yourself, and share it with all your residents. Although the personal activities have to be done on daily basis, just please make it a habit that you sometimes just quickly check, is your family safe? Are they practicing all the measures? Like you check, once you go out of the house, you ensure that you wear a mask. So similarly, as you are stepping out of the house, are we wearing full sleeves? Have we used the spray to protect ourselves from any bite outside our home? The moment I step out, mosquito can be outside. And is my home inside safe? Are my doors and windows closed? So this kind of spot check, get in a habit of checking, is my family safe? Is my house safe? It just takes 10 seconds of checking around. It's just being aware of it. No, it's not an activity as such. Then Wednesday, we'll send you another infographics, which will be about dengue and what care to be taken at home if anybody's called sick. Educate yourself, share it further. Likewise, on Friday, then we'll share the material on what is Aedes mosquito, where it breeds, what are the potential areas, right? And on Saturday, you encourage your residents through a communication mechanism that they do identify and look for potential breeding site in their houses and try to make their houses safe. The activities which I've asked you to do as a person, motivate your residents to do those activities as a person next weekend. So we'll use this week that you do it yourself and you educate your fellow residents. So we want that by Sunday, for your interest also, if you can form small group of volunteers as no fever teams, and then check for the breeding sites in the RWA area. Right now, I was just asking just house and nearby, but do this activity, identify what are the potential areas, so that the next weekend when we provide you with products, you can actually do something to clean, or you add Temifos or use sugar beets, wherever. So you can plan your steps ahead. So 9th of August, have a meeting with no fever teams, ensure you follow all COVID related prevention measures and do some activity together. And following on, these communication should continue. And we plan that on 15th of August, mostly, we will plan a bigger launch of the program, and we will even invite the residents of your welfare associations to share the information with them, as well what steps to be done, and the products which we'll be sharing with you to make your homes as well as RWAs safe. So that's the activity plan for now. We'll be sharing a checklist with you through Telegram, and you would be requested to check those boxes and share your experience with us. How much were you able to do? What your specific requirements are, and then we formulate our program as per your inputs. Your inputs and feedback is very important for us to give it the final shape, right? So that would be all from my side. Just last messages: start with personal protection, make your house safe, make your RWA area safe, then go on to looking at your neighborhood, where we will require GHMC and other groups to play a role. And if sick anytime, please take care timely. That will be all from my side. And I'm sure you will have some questions now regarding any of these activities, how to go about it, and any other questions which would have come. I open this up for the questions. And Rajan, can you please help me if any questions have come along while I was speaking?
No, Samiksha, I don't know whether you can hear me. My system has frozen.
No, we can hear you.
Okay. No, there aren't any questions, but we are running overtime. So if there are any attendees who, especially RWA members who want to ask one or two questions, we can quickly take one or two questions and then close the session. Samiksha, my screen has frozen, so you will have to take control.
Okay, right. I see there are not many questions here from the attendees, but our messages have gone through. And as promised, once we start sharing with them the specific materials, information, they will have more questions. And so far, we have had a lot of questions, and we will try to put them into frequently asked questions document, and also try and share that with you in the next week's time. So our focus for the next 2 weeks is increase awareness, build partnerships, and help you keep you and your house safe before we go on to next steps. I guess that would be all from our side. Any other panelists? I'll request Dr. Karunakar Reddy from DRL to say the final remarks or final suggestions for the project. Dr. Karunakar Reddy.
Thanks, Samiksha and Rajan, Murtigaru, and Sauri and Yatish and moreover, Joshua for working behind the scenes and making it happen. I think it's an excellent information what we have shared now. I think the last lot of questions what we are answer what we're going through is, can we welcome an RWA? I think panelists have already answered. Yes, you can invite your RWAs or the members. RWA is a resident welfare association. In case you don't have a resident welfare association, you live in a villa or nearby, collect 2 or more or 3 to 4 members and rejoin as a group. So that's much easier. If nothing is possible as an individual, please search in Telegram app for Project No Fever, and you can join yourself and share those documentations as we will be sharing, as Samiksha shared and talked about during the meeting. At this time, Samiksha, I think that's it from my side. Thank you so much for all the volunteers and the Residents Welfare Associations who have signed in and provided the documentation. Samiksha, right. What to you?
Right. Thank you, everyone. And before closing, I just request you all to take this quick quiz, 10 questions. We'll keep it on for the next 2-3 minutes. You can finish this quiz as you sign out. Thank you, everyone. Thank you all for joining. And we'll keep in touch. We now have the list of our participants who are willing to join us. We'll soon receive the letters of enrollment also. We'll form a very close group and also a mechanism of contacting you. You will very soon hear from us how to take it further. Thank you, everyone.
Thank you, Samiksha. Thank you, everybody.
Attendees, we request you to please take this quiz. You will realize how much information you know and how much you would need to know in coming days to come. We often don't talk about dengue, and it's taken a backseat in COVID times. Let's try to bring it forwards. This poll is totally anonymous. We would not know who has answered these questions, but we will have an idea in general about what is the level of awareness and where we need to emphasize. Each of your poll or answer given is very important for us. Please continue doing the poll. I see already 5 of you are doing it or maybe even completed it, and I'm hoping the others are onto it. Even the panelists can do it. I'm sure they will find it difficult to have all the 10 correct.
And Samiksha, how do we know if we got the answers right or wrong?
Oh, we'll share the answers with you. You will know it for yourself if you were right or wrong.
Thank you.
So when we share the information, we'll share the correct answers for this quiz also as part of our communication through the Telegram group. Okay, while you take the poll, I see another question which has come up here, that if the mosquitoes feed on the sugar baits and they feed on the insecticide, and if that mosquito bites the human, will they still be infecting the human with the insecticide? See, if the mosquito feeds on that sugar, which has insecticide mixed with it, the mosquito most likely will die then and there, right? And if not, the concentration of insecticide with that sugar and what the mosquito can take it in will be very less, that it can transmit the insecticide to the human and biting. So that's not of concern. Sugar baits mixed with insecticides are found to be very safe. It does not spread the insecticide from the sugar bait to the human in any manner. So don't be afraid of it. The mosquitoes will kill if they feed on that sugar within few minutes time. You'll see wherever you keep that bait, you will see the dead mosquitoes around it. They just get killed.
Yeah, Samiksha, just to add another point, the insecticide which is going to come through a mosquito which bites you, compared to that, your vegetables have much more insecticide levels and are much more dangerous. So don't be worried about the mosquitoes. Here, they are less dangerous compared to the vegetables that we get from outside.
Right. And a lot of you have also had concerns about that water collection is of different types, right? There's one big ponds or empty plots where water is being collected. That kind of water collection is to be treated with a different chemical. And the water collection which is in your house or in near your house, which is drinking or potable, or which your pets, birds may also have be drinking from. You can use Temifos. Temifos is being promoted here because Temifos is a safer chemical. It can also be used in drinking water as well as in pools. It's safe. That's why we are promoting it. So yes, as per your query, because we are starting with the Residential Welfare Association house and the area near house, we are aware of it and very consciously we are promoting Temifos. The moment you start raising queries of bigger plots or pool of water where GHMC will be taking action, the concentration, the amount of insecticide and what insecticide to be put there will be taken care of by GHMC. If there are any delays from the GHMC side, which we do not foresee because they have promised us a good partnership and they have demonstrated it in last week, we shared that example with you. So we do not worry, but in case that would not be feasible by any means, then we will be able to support you and try and procure the material and means to take action on those bigger pool of bodies. But that would be on case-to-case basis as the project moves forward. So we'll try and support you in any manner. But as I keep saying, because the mosquito flies 100 to 200 meters, first check your individual homes. Make sure that your fellow residents keep their houses clean. Make sure your colony, your resident area is safer. If you manage to do that, you have built half of the battle.
So Samiksha,
Yeah.
Karnakar is saying there's one raised hand, but before that, just adding to what you said, I'll just say this is one example where love thy neighbor and love thy neighborhood is very important.
Right. So I see a hand raised, but it has disappeared now. I guess we answered whatever the question was to be. Thank you. I see 21.
I think the question there is that on YouTube, they're unable to take the quiz.
Sir, on YouTube, whatever questions were put, we'll announce that next time. Pavani has been able to collect those questions and put them in the chat here. So during
the thing is, on YouTube, they're unable to take the quiz.
Oh, right. We'll have to figure that out. Great. So what we'll do is, who all have joined through YouTube, if we could manage to have their contact details, we'll send this quiz to all our participants. I'll have to figure it out, sir. Through Telegram or something, we'll send the quiz as well as the answers.
Sure.
Let's put the same quiz in our Telegram group, now touching almost 100 volunteers through this session.
Yeah, definitely.
I think it is a one-way broadcast medium. Whoever has joined via Zoom was able to take the quiz, but whoever is on YouTube, please join the Telegram group. Look for Project No Fever in Telegram, and we will post it, and you will be able to take it and see the results.
Right. I see 23 of the 25 participants have already voted the poll, and no more seems to be taking the poll. So I think we should close the session now, and we'll share the results with you soon. Thank you, everyone. Thank you all the panelists, and thank you all the attendees.
Thank you.
Thank you, everybody. Please encourage participation of everybody.
Thank you, Shari. Thank you, the DRL team.